Hormone replacement therapy will now be available over the counter without a doctor's prescription in order to make it more accessible to women going through the menopause.
So it comes as an inaugural meeting of the UK Menopause Task Force took place with the aim to increase access to treatment and end the stigma surrounding the change.
But does HRT help or simply postpone the hot flushes, headaches and mood swings of menopause?
We're joined now by Dr. Martin Kinsella, an aesthetic and hormone doctor in Cheshire. Thank you for joining us. I mean, what do you think about it being made more accessible by making it over the counter? Do you think that's a right decision?
Well, firstly, if you look at the actual facts are, I think it's a proposition made by the MHRA, they're the UK medicines regulator. And what they're proposing to do is make Gina 10 over the counter. Gina 10 is basically a tablet containing a form of estrogen that's delivered locally into the vagina to treat vaginal dryness. Vaginal dryness affects lots of women going through the change in the menopause. While I applaud or agree with the increased awareness, while I'm all for women being able to get more understanding about the menopause and having better access to care, there definitely are some concerns about making hormones available over the counter. Firstly, I believe pharmacists will be trained to identify people and use checklists, but unfortunately, there may be things that there could be dangers with this. There could be certain things underlying that are missed. So there might be changes to causing vaginal dryness or atrophy that are not hormone related, such as there are dermatological conditions like lichen planus that potentially even things like cancers could be masked or missed. And also hormone imbalances throughout the body can also go unchecked. So I think that's the first issue. And also, if this is the first medication that could potentially be available over the counter, once we've started with that opens the door to other hormones and other types of HRT being available. And hormones are some of the most powerful molecules in your body, and any type of medication that's designed to replace or replicate what they do has huge impacts both on the physiology and the runnings of our body. I feel that for that type of treatment, it really needs to be done under medical supervision. Blood tests need to be taken, levels need to be done, and really hormones need to be more tailored and given in a more tailored, customized, bespoke fashion to patients.
Is there a worry here if there's this kind of medical gatekeeping, that we're not trusting people enough to, if they feel something is wrong, going to seek that help, and of course encouraging people to talk to doctors, but the fact that something should be able for an individual to buy if it's about that individual's own body, isn't there a point of principle here that we should be leaning more towards allowing people to do what they want?
Partly, as long as it's safe. These are like I said, this is estrogen that's given locally. This can help with vaginal dryness and vaginal atrophy if it is hormone-related vaginal atrophy. Those kind of things need to be assessed by medically trained professionals to assess that first. So I am all for increased access, increased awareness. Menopause is a serious problem. It affects the quality of life of millions of women in this country, and we need to have a better understanding. But promoting the idea of allowing women to go and self-diagnose, or making them feel like they have to then self-diagnose to get care. What we should be doing is investing in better education to both the patients and the menopause doctors and GPs. We should be reducing the stigma and taboo of this problem so that they can talk to doctors and have better access to the medical professionals, rather than, as I said, making women feel like they have to self-diagnose their problems and start self-treating, because that is where problems will start to happen.
And finally, Dr. Kinsella, I mean, this is hopefully trying to raise awareness of some of the issues that many older women face. I mean, but do you think that enough is done as a society to raise awareness of and think about some of the issues that women face as they get older?
Well, it's a very good question. I think definitely. I think certainly when it comes to the hormone changes, I mean, hormones have a huge impact on our body, and also, the effects of aging in general. I think we seem to we always think of aging as something that just happens to us, but actually there are certain, mechanics and medical things that are going on within our cells, the hormone changes, all sorts of problems that really do affect older people generally, and especially women with the menopause. And like I said, I think we should definitely increase the awareness. I think that we need to have better education on this. I think there needs to be some much better support mechanisms in place for women going through these changes, but it has to be done in a safe manner. And there needs to be a better education and understanding about hormones and things that are happening to the body.
Well, Dr. Martin Kinsella, thank you very much for your views this morning. It's a really interesting issue and something that I think people really, really care about at home.